All right, everyone, I think we'll go ahead and get started here. You're here for our final learning community session titled Adolescent Tobacco and Vaping Cessation Counseling. Just a couple of quick housekeeping items. Today's session is being recorded, so we're going to keep microphones on mute. But if you're prompted for a question, please feel free to unmute yourself and ask it. Otherwise, you can ask them in the chat box throughout and at the end of the presentation. If you feel comfortable leaving your cameras on, it's always helpful to see everyone's smiling face, but no pressure. There will be a post-training survey after the presentation today, and Gianna will make sure to post that link into the chat box. With that, I'll introduce Christy here. Christy Boland is a Master of Public Health and is a Program Manager for the Colorado Association of School-Based Healthcare. She has over 8 years of public health policy experience working to increase access to quality and affordable health care for families. And she was also formerly a bilingual smoking cessation coach for the Colorado QuitLine. And with that, Christy, I will pass it over to you.
Thank you, Kevin. Thank you so much for the opportunity to speak today about this really important topic. And we have a lot to cover and a lot of information. If you have questions throughout, please feel free to chat in. And Kevin, if you wouldn't mind helping me monitor that, feel free to interject if you would like to ask those questions as we go through. With that, we will get started with adolescent tobacco and vaping cessation counseling. Next slide, please. So I would really like a shout out. I'm presenting today, but I would really like to shout out to a couple of people who have helped with contributing their good thoughts and thinking and revisions and input on these slides. So special thanks to Judith Tiku, Didi Valles, Christina Green, and Michelle Lynch, all from the Colorado Department of Public Health and Environment. This is certainly a team effort. All right. And on the next slide, please. I am doing this presentation at the request of Christina Green. She said that she received feedback from you all as expert providers about wanting to have some additional information related to smoking cessation, counseling and vaping and referrals to treatment and that sort of thing. So I want to make sure we have talked back and forth, and she has reviewed these slides to make sure that they're on target for what you are looking for. But I wanted to also ask, what are you hoping to learn today? Just so you can get that off your chest, and I can make sure to keep that in my mind as I'm going through this information. If anyone would like to unmute themselves or chat in what they're hoping to learn.
Hi, this is Amanda Jeffries. I'm with Stride Community Health Center. I'm really wanting to learn about the vaping. I know a lot about traditional tobacco usage, but not vaping. So that's what I would like to learn some more about.
Okay. We will definitely talk about vaping. Frankly, we could talk all day about vaping. There's a lot of stuff out there, a lot of things that are changing, a lot of new information, slowly a little bit more research, but we will talk about vaping. And then when we're done, if I haven't addressed something that you're particularly curious about, please let me know and I'm happy to follow up. Anyone else?
Hi, it's Rebecca Doty. I am really interested to know if the same techniques are used for someone that is wanting to quit vaping as opposed to someone who is wanting to quit cigarettes.
Okay. Good questions. Anyone else? I made a note to myself to address those, but again, if we get to the end and I have not addressed them, please remind me and bring that to my attention to make sure that I do. All right, so we will move on to the next slide, please. So here are our learning objectives. We really will be talking about some new research that has just come out around youth tobacco prevention and cessation in particular, being a little bit different than adult. We'll also talk about some brief interventions for tobacco to prevent tobacco initiation, some referral to treatment options. We'll talk specifically about vaping versus smoking quitting. And Christina also asked me to give a little reminder about entering data into the Just Health Provider Review related to the great tobacco cessation counseling and referrals to treatment that you guys are doing. So that is what we plan to cover. On the next slide, please. We'll get right into the tobacco and vaping overview. So on the next slide, Kevin, you all will see here are some statistics around vaping in particular. So we know smoking remains the leading cause of preventable death in the United States. And in 2017, Colorado had the dubious distinction of leading the nation in the use of nicotine-containing vapor products like electronic cigarettes or vaping among young people under the age of 18 years old. We know in 2017, data show that 33% of high school youth in Colorado reported using tobacco products, which includes all forms of tobacco products: cigarettes, cigars, chewing tobacco, hookahs, and e-cigarettes. With rates rising each year, each grade, from 18% in 9th grade to 34% of 12th graders. It is important to note, however, that in 2017, smoking rates were only 7%, which is at an all-time low in Colorado. So we really want to call this out as a public health success story. But it's the vaping among youth that is really threatening to undo these decades of control policy progress that we have been making. But I really want to reiterate how important it shows that this is a crisis, but it is also something that we can do about. And the great work that you guys are doing to screen youth early and to intervene early to prevent initiation in the first place, and then to respond with treatments needed is really critical. And we can win this battle, or at least decrease this battle, this vaping epidemic as well. Additionally, more data to show how important the work that you guys do is that research indicates 90% of cigarette smokers started before the age of 18, and nearly 95% started before the age of 21. So people are going to smoke, or they're going to start when they're youth, and when they're, and so again, reiterating the importance of preventing that from happening or intervening early if it has happened. We know that there are disparities among which youth vape. For example, there are particular racial and ethnic groups that have higher rates of vaping as compared to their white counterparts. American Indians, for example, young people vape at 30%, and Pacific Islander youth at 33%. We also know that LGBT youth have a much higher tobacco and vaping use than their cisgender and heterosexual counterparts. For example, 44% of transgender youth report vaping, and 32% of youth who identify as lesbian, gay, or bisexual report that they vape. Another thing about vaping that we know, and that you might hear from youth, what's the big deal? Isn't it just harmless water vapor? Well, a growing body of evidence indicates that e-cigarette vapor is in fact it's not harmless water vapor and can contain toxic metals. And another thing that you might hear youth say, some youth, and I've seen data that show that a majority of youth don't realize that vaping contains nicotine. Research has indicated that even those vape products that you see out there that claim to be nicotine-free, that when they're actually studied to evaluate that claim, that trace amounts of nicotine are found in even those that purport to be nicotine-free. We also know that vaping nicotine can result in cognitive impairment, mood disorders, lowered impulse control. And for youth, this is particularly important to emphasize with them. We know from research that nicotine use amongst young people increases their risk for addiction. In fact, it appears that nicotine sort of rewires the chemistry of the brain in order to make it more susceptible to addiction for the duration of the person's life. And that could be addiction to not just nicotine as a substance, but other substances as well. So another really great reason for youth to prevent the initiation of tobacco use in the first place for youth. Now let's talk about flavors. We know that a key driver for high rates of youth vaping are the flavors. The research shows currently that 81% of youth who ever tried tobacco choose flavored tobacco as their first tobacco product. And 7% of youth, I'll say again since I fumbled a little bit there, but a whopping 97% of youth who vape use flavored tobacco products. So it really shows that as smoking rates have fallen across youth, and we saw the low rates of smoking rates for youth in Colorado, the tobacco industry really knows that flavors are a key way to attract and addict youth to vaping and create a new generation of lifelong tobacco users. One other thing I'll mention, that I'll say that there is evidence coming out that vapor includes a whole host of chemicals, including propylene glycol, which is like a preservative, diacetyl, and other chemicals. So I think the more research comes out, the more products are looked at, just like was the case with tobacco. We'll find more and more evidence of the harms that are in vapor. All right. So next slide, please. I wanted to talk as well a little bit about some of the tobacco and vaping policies and laws that have changed in the last 6 months or so, because there have been a few changes. One that you've probably heard of, the Tobacco 21 law, as of December 31st of 2019, the law was changed, so it's now illegal across the country for retailers to sell any tobacco products to people under 21, and that includes all forms of vaping products. And then I also wanted to talk a little bit about this vapor flavor ban that you may have heard of, which is a new federal law that went into effect in February of 2020. This new federal law or policy on flavored e-cigarettes is a far cry from the total ban of flavored cigarettes or vaping products that the president proposed and that what advocates were encouraging to stem the alarming rise of youth vaping. It really just limits flavors for specific e-cigarette devices, and it creates as many loopholes as it does restrictions. So this new Food and Drug Administration policy only prohibits flavors with an exemption for the popular flavor menthol and e-cigarette products that use what are called closed system e-liquid cartridges. So what this really means is that all menthol flavors, all menthol flavors in any form, including jewel pods, and all flavored liquid nicotine like cotton candy and gummy bear used in any disposable or refillable cartridges, those remain on the market and they're still available for use. And we know evidence shows that, like I said, flavors are a key driver for youth initiation and use. So exempting menthol, for example, is a flavor that with mint, 63.9% of high school e-cigarette users reported using in 2019. They reported using menthol. So this really just creates an opportunity for the e-cigarette manufacturers to rename what they previously called mint as menthol, and that's still allowed in all forms of e-cigarette products. So as advocates, we really still have a lot of work to do here with continuing to push the needle on policy changes with regard to flavored vaping products. Next slide, please. All right, so I wanted to show you a couple of pictures of vaping products that are disguised as everyday objects. And, you know, I've had a debate with a colleague of mine who is also in tobacco control work and who also talks with healthcare providers and schools and parents. And she says, you know what, Christy, I don't like to show healthcare providers or teachers or parents these devices because it makes it look like teens are being sneaky and that everyday products are being used all the time for teens to vape. So you can see in these pictures here, we have this first picture that shows it shows a young person who is using the string of their hoodie and is able to put a cartridge in there and vape through the string of their hoodie. Below that, you see a phone case that has a little device that pops out that allows someone to vape through their phone case. The backpack has a tube that slides into the strap, and you can pull out the tube and put in a pod and vape through that. And then below that backpack, you see a pen. I know we call vaping devices vape pens sometimes, but this is a real actual pen that both writes and you can pop off the cap, take it out, insert a pod into it, and use that to vape. So like I said, I'm not showing you these. I hope the takeaway isn't that, oh my goodness, every kid's backpack, they're vaping out of everything. They're all being sneaky. They're all using it. As we just said, the data indicate that the majority of youth, in fact, don't vape. And that's something you can remind your students as well. But I wanted to share this for you for two reasons. One, I think these products are designed not as a sneaky way, not as a way for teens to be sneaky, but more for as a sneaky way for the tobacco industry to make it easy to vape anywhere at any time. And this really helps turn perhaps what started out as they all do, casual usage, into really establishing tobacco dependence. And secondly, I wanted to show you these devices because as providers doing expert work, it's really important to understand the habits and drivers of tobacco use so that you can tailor your interventions and counseling strategies to these. If you have a student who is using any one of these devices, it probably means that they are vaping all the time, everywhere. We've heard anecdotal stories, and you can read about them throughout some of the apps and things like that I talk about later in this presentation, of youth who indeed talk about their habit becoming that, something that they did all the time, everywhere. And that's really important to understand as a provider, as I said, so that you can help tailor your intervention and counseling strategies to that pattern of use. All right. So I know I've gone over a lot about vaping so far. Is there any questions right now? I've seen a few messages pop up, and I wanted to make sure that there were no questions.
No questions so far.
Okay. I will also say there's a number of presentations and modules, webinars that are out there, particularly the Behavioral Health and Wellness Center out of the University of Colorado has some excellent presentations that are archived and available online that go into a lot more depth around particular, like the latest trends in the particular vaping devices that are out there. All kinds of the debate for adults about, is vaping a way for people to actually quit smoking? There's a whole lot more information out there, and I'm happy to point you to that information if you want to go more into depth. I just wanted to give some basic overview of data here in Colorado, new laws and policies, and then, like I said, ways to think about how the students that you're serving are vaping, and so that you can tailor your interventions appropriately. All right. On the next slide, we're going to spend a little bit of time talking about the latest research out there, the latest evidence about what works for youth, and what's the synopsis of the evidence out there. So recently, in fact, just at the end of April of this year, the United States Preventative Task Force released new recommendations related to tobacco use for youth. And so what they do is they assess all the research that is out there, the body of evidence, and they have a standard that they go through to assess whether they're going to recommend certain interventions as being effective or not effective. And they have a rating scale for how they do that based on the strength of that evidence. So in terms of preventing initiation or preventing starting of tobacco use, what the task force says is that providing education and brief interventions to prevent tobacco initiation has shown to be effective, approximately doubling abstinence rates when compared to usual care. And another thing I wanted to mention about this is a predominant factor associated with youth initiation of tobacco is related to parent use and dependence. So that's another question that you can ask to help understand a little bit about maybe the risk of initiation for a particular student is, you know, that can come up in the screening related to secondhand smoke or tobacco exposure. You can ask if that's parent usage. On the next slide, you will see what the United States Preventative Task Force says about what the evidence says related to tobacco cessation for youth. From research with adults, what we know is that the most effective method of quitting tobacco is to combine pharmacotherapy with behavioral counseling. So the medication addresses the physical addiction, and the counseling is meant to address behavior change. But unfortunately, there is just insufficient evidence to assess effectiveness of youth cessation interventions. And that's not the same as saying that our interventions don't work. It just means it has not been adequately studied to meet the standards for the U.S. Preventative Task Force to issue a recommendation that's specific to youth. So that's what the slide says. There's insufficient evidence to assess effectiveness of strategies. It also says that no medications are currently FDA approved for youth cessation, again, because there's limited research studies on quit medications for youth. However, there is no evidence of harm related to using nicotine replacement therapy specifically in youth under 18. And at the request of a specific school-based health center, I asked some questions to the Department of Public Health and Environment's tobacco cessation team related to NRT or nicotine replacement therapy for youth. And they put together an FAQ document that I'll share with Kevin to share out to you all. And what they said there was that given the evidence of quit medications for adults that they're effective and the severe harms of nicotine dependence, what the American Academy of Pediatrics policy recommends is that medical providers consider off-label prescriptions of nicotine replacement therapy for youth who are moderately or severely addicted to tobacco. Youth under 18 require a prescription to use over-the-counter or prescription NRT products. And Colorado has no age limits for coverage of tobacco treatments, including NRT. So again, in summary, I know that's a lot of information and some of it feels a little bit contradictory, but CDPHE had asked me to share these recommendations from the United States Preventative Task Force. And while they say no medications are currently FDA approved for youth cessation, there is guidance from the American Academy of Pediatrics indicating that you could consider off-label prescription of NRT for youth who are motivated to quit and who are moderately to severely addicted. And I'm happy again to provide the FAQ document to you guys so you can see what else CDPHE has said around that. I know that's a lot. Do you have any questions so far on that in particular? All right. On the next slide, there is some evidence related to mobile-based interventions as being recommended by the Community Guide to Support Cessation in Adolescence. And the evidence shows over 70% of youth have access to a smartphone, making this approach one that has the potential to reach a fairly large number of adolescents. And we'll talk more about mobile-based interventions for tobacco cessation a little bit later. And then finally, with regard to what the evidence says for what works with youth, as expert providers, it's important to remember that the systems that you're putting in place to support treatment of tobacco as a standard of care in your clinical setting is an evidence-based approach for improving cessation. And integrating those cessation interventions into routine clinical care increases the likelihood that you both intervene with patients and that patients will alter their tobacco use. All right. So on the next slide, we're going to move into talking about some tobacco cessation interventions, particularly the 5 A's and stages of change in motivational interviewing. On the next slide, you will see there. Did we lose the slides, Kevin? Looks like.
Yeah, I switched it over to the link, but
Gotcha.
Trying to get it to here.
Okay. So what Kevin is pulling up is what is the Adolescent Expert Algorithm for Secondhand Smoke Exposure and Use of Tobacco and Vape Products. So this is an algorithm that was put together by CDPHE and us, the Colorado Association of School-Based Healthcare, that looks at what steps that you can take when you are, there she is, thank you. When you have that, there's answers to the questions that the students have put into Just Health, what to do if they've answered the question about exposure to secondhand smoke or vapors as negative. what to do if they've answered that as positive, and what steps to take if they're using tobacco products. So it'll walk you through the brief interventions and referrals to treatment options. This is a 2-page document that below will take you through those different steps. So this might be, if you find it useful, a handy reference for your desk, if you're visual, like I am, as a reminder. And it's just a summary of a lot of the things that we're about to talk about in terms of your approach to an algorithm to follow for your interventions with students. All right.
Christy, I can link the chat box if you'd like.
What's that, sorry?
I could link this in the chat box if you'd like.
Perfect, thank you. It's also available on the CDPHE expert website. All right. On the next slide, and you'll forgive me, it looks like there was an editing error that I overlooked on this slide, but I wanted to note, as we talked about earlier, that research indicates that providing education and positive reinforcement for healthy choices is effective at preventing tobacco initiation. So if you have a student who you see screen negative for tobacco use, praise them and ask them what keeps them from using tobacco in the first place. And if you have youth who indicate in their screener that they have already started using tobacco products or vaping, use positive reinforcement to highlight any shift in attitude, any attempt to decrease use, even the willingness to talk about their use. Anything positive that you can reinforce, no matter how small, is helpful. And if you encounter, as I'm sure you will, students who are not yet ready to quit, you can ask questions like, on a scale of 1 to 10, how motivated are you to reduce or quit your vaping use? And if they say 3, I'm not that far, I'm not really that interested in it, you can ask, great, what keeps you from being a 2? And in that way, you can really focus on any small reason that they may have or may be considering for reducing their tobacco use, and use this as an opportunity for positive reinforcement. And in this way is a way you might begin to move the needle towards progress on the stages of change. All right, next slide, please. So with the STEP project, which is the tobacco-funded project that we use with some of the school-based health centers, I know a few of you on the phone are STEP sites as well. We use this particular tobacco cessation intervention called the 5 A's. The 5 A's being ask, advise, assess, assist, and arrange. And this is an approach to depict the cyclical, this particular picture of this approach depicts the cyclical nature of tobacco addiction and treatment. So we know tobacco dependence and use is a chronic relapsing condition that requires repeated interventions and a systematic approach. On the next slide, you will see a little bit more detail about the 5 A's, about how to approach it. And again, this is a brief intervention for treating tobacco independence, and it was designed as a useful way to understand and address treatment and to organize an approach to an intervention. Now, Christina shared with me that as expert providers, you have been trained by peer assistants in motivational interviewing techniques, the BNI technique and the DARN technique. And this 5 A's is another method to use and assess readiness to change and motivate people to take action. So you can see about asking about tobacco and vaping use, advising the patient to quit, assessing their readiness to quit, assisting the patient in quitting, and arranging for follow-up. And because Christina had said that you guys had received some training related to these other techniques as used by expert, we decided to go a little bit less into detail on these particular steps. However, if you would like some more additional or in-depth explanation, there's a great series of webinars. There's one that focuses an hour just on these 5 A's that's done again by the Behavioral Health and Wellness Center at the University of Colorado. They have a whole series of tobacco cessation modules. And so, like I said, since there's other techniques that you guys are using and other availability of an in-depth discussion of these 5 A's, I'll leave it at that for now and talk a little bit more on the next slide about just the idea that these 5 A's are based on the trans-theoretical model or the stages of change, and your approach will be different depending on the individual stage of change, of course. I know we've heard from different providers that we're good, we've got this motivational interviewing thing down, but you can use these 5 A's and stages of changes as a guide to note that everyone moves through stages of change in different ways. It's not necessarily linear. For instance, people may go back to old behaviors during stressful times, like now, and change is really a straightforward path. During these times, help individuals review their experience, identify what worked and what did not work, and prepare to practice new behaviors. And one of the things that I used to use a lot when I was a smoking cessation coach is really talking to people about understanding what is driving their use, what benefits are they getting from their use, and then to really look at what kinds of different circumstances, events, people, emotions, times of day drive their use. And so you can ask a lot of questions to help youth understand. And if they're willing, even consider asking them to be, especially people who are early, maybe they're just in the early stages of contemplating change, but they're willing to look at their habit. You can ask them if they're willing to imagine that they are impartial observers of their own life and they're watching without judgment and really noticing when they're vaping, what's going on, who are they with, is it a particular time of day, a certain group of friends, are they feeling bored, are they stressed, are they anxious? And if they're willing to write down those times, just to note when are they using, how are they using, and that can help them strategize for the future when they do move through these stages of change, and if they're ready to take action to reduce or to set a quit date and to stop, to come up with a game plan around, okay, I notice that I always vape when I'm around this particular group of friends. What's my plan with regard to this group of friends? Do I have any allies that might be able to support me? What am I going to do to manage my stress if I'm not vaping? Those sorts of things. All right. On the next slide, please. We're going to move into talking about some tobacco referral resources that are out there available to you all. On the next slide, there is an app called Smoke-Free Teen. And it's a cell-based service, as we talked about before. These mobile-based services are showing some evidence of effectiveness with young people. One of them being the Quick Start app. It's a free smartphone app that helps quit smoking with tailored tips, inspiration, and challenges. This Quick Start app is a product of smokefree.gov, which is a smoking cessation resource created by the Tobacco Control Research Branch at the National Cancer Institute in collaboration with the U.S. Food and Drug Administration and input from tobacco control professionals, smoking cessation experts, and ex-smokers. They also have a dip-free text option. I know in particular areas of the state, using dip is more culturally common and acceptable than others. And so if that is an issue with the particular population that you serve in your community, know that there are specific resources for teens who dip, as well as they have live help and chat features available. On the next slide, this talks about This Is Quitting Vape program that's put together by the Truth Initiative. This is a free mobile program designed to help young people quit vaping. The first of its kind text messaging program was developed to incorporate messages from other young people like them who have attempted to or successfully quit e-cigarettes. Text messages show the real side of quitting, both the good and the bad, to help young people feel motivated, inspired, and supported throughout their quitting process. This Is Quitting will also send young people evidence-based tips and strategies to quit and to stay quit. And it's tailored based on age. So they have a program that's designed for younger teens, 13 to 17, and then for more of the young adult population, 18 to 24, which I know some of your clinics will serve young people up to the age of 21. So it's a little bit tailored in that way. And I wanted to say a couple of things about this particular resource. One, it's important to emphasize to the students that you serve that despite its name, This Is Quitting is not just for youth who are ready to quit. So I know, because we've heard from school-based health center providers in the past saying, you know, Christy, I can give people referrals day in and day out, but if they're not ready to quit, they're not going to call. And so note that this can be an excellent place for youth to go to find out more information, or just to connect to youth like them who are contemplating quitting, going through the process, have tried it, and they can learn lessons learned. This might be particularly important to those who feel like everyone they know around them vapes. And I think that the Truth Initiative is also really good at meeting youth where they are. They have done a couple of TikTok challenges, and they just launched their second TikTok challenge as part of their Ready to Ditch Juul campaign. This was earlier in the spring that this happened. This challenge comes on the heels of the first Truth Challenge and national campaign that launched in January of this year, when, according to recent data, nearly 50% of young people said they were looking to quit vaping as a New Year's resolution. And the initial challenge had more than 1.8 billion views on TikTok and more than 365,000 TikTok user-created videos to help young people nationwide quit vaping. And so, again, it's a good place for youth to go where youth already are and have that conversation amongst their peers and see funny, silly, crazy videos about how youth are ditching Juul and other vape products. So, and one other thing I want to mention about the data around the effectiveness of this particular app is that preliminary data published in the Nicotine and Tobacco Research journal show that after just 2 weeks of using This Is Quitting, more than half, or 60%, reported that they had reduced or stopped using e-cigarettes. And so it's simple for young people to join. They can text Ditch Juul or Ditch Vape to 88709 if this is an option that you think is good for the youth that you are serving. On the next slide, you can see, I have found in my work that the Truth Initiative really has a lot of great info that supports me and my work. So if you're looking for the latest trends with vaping, if you're looking for flashy, already put together infographics like the one you see on your slide, if you're looking for materials to support the parents of the students you serve, flyers for your school, the latest research, they already have information on here about the pandemic and COVID-19 and vaping and habits and that kind of thing. Check out the Truth Initiative to find that information to support you in your work as well. They also have great information about different topics depending on the population that you're serving. For example, there's a fact sheet linking showing the link between marijuana and smoking. There's fact sheets on menthol, on smokeless tobacco, hookahs, LGBT youth, flavors. There's, I find it to be a really helpful youth resource, and they've already put together all these pretty infographics, like I said, which I like. So, on the next slide, we'll talk a little bit about the Colorado QuitLine. So, the Colorado QuitLine has a youth-specific component to it. And again, I want to emphasize in this case, I know I've heard from providers out there that youth associate the name QuitLine as meaning that they need to be ready to quit in order to utilize the services. And in the past, that was the case, that callers had to be ready to set a quit date in order to enroll in the counseling program. However, please emphasize with your youth that that is no longer the case. You do not need to be ready to quit in order to utilize the services provided by the Colorado QuitLine. So the QuitLine is available to all Coloradoans who are at least 12 years of age, regardless of their insurance status, what type of tobacco they use, and like I said, the stage of change they're in. The call center is open from 5 a.m. to 11 p.m. 7 days a week. And then there's also e-chat coaching available on the web. Those hours are a little bit different. They're 7 a.m. to 9 p.m. Monday through Friday, and 7 a.m. to 7 p.m. on the weekends. All languages are served. There are bilingual counselors who work at the Colorado QuitLine like I used to, but they also, if you have students who prefer a different language other than English or Spanish, they do have access to translation services as well to serve folks in the language that they prefer to speak. Services are inclusive, non-judgmental, and free of charge. One thing though, you do have to be at least 18 in order to receive free nicotine replacement through the QuitLine. So that is unfortunately something that doesn't serve youth quite as well. So on the next slide, talking a little bit more about youth services through the QuitLine. We've talked about some of the telephone counseling available. It's motivational interviewing based and individualized and person-centered. And all of the coaches who work with youth are trained specifically to work with that population, with young people, as opposed to, it's a different strategy when working with an older, chronically ill smoker. So the Colorado Youth QuitLine also has some digital services available, including e-coaching, like we mentioned, and some web chatting. There's also a peer forum. So this is another place for young people to go and talk to their peers. You should know that the peer forum is available on coloradayouthquitline.org. It's not moderated live by a quit coach. However, not moderated, I should say. So there is no coach interaction here. It's just a peer forum, but it is monitored in case any inappropriate information or inaccurate information is shared so that that can be corrected. And then coming up, at least the plan has been coming up in the fall of 2020 to transition and make more robust these e-services available at a new website that we'll be launching called mylifemyquit.com. So I should put in a caveat there that this has been the plan for a long time, that there would be the fall rollout of these new enhanced digital services for youth. However, given the state budget situation with the pandemic, the way that the QuitLine, as well as a lot of tobacco control efforts in the state, are paid for is through tobacco tax money, which the legislature can reallocate when there's a fiscal emergency declared, as there has been. And so quite a large amount is going to be reallocated, but that currently goes to support tobacco cessation and tobacco control efforts across the state to shore up the state federal budget, or the state budget, and provide other medical services. But I was assured by the QuitLine that the intention, despite these cuts, is to keep the Colorado Youth QuitLine services available for web-based services, for phone counseling. So we don't. So that is the intention given these coming budget cuts. All right, next slide, please. This is just an overview of some of the Youth QuitLine system changes that have happened over the past 2 years, and then what was planned for the fall of 2020. So the good thing is the QuitLine is really focused on continuing to evolve the services that they provide and continuing to learn from best practices and from research and continuing to try to make the service as effective as possible to reach all populations in Colorado, including youth. The next slide. I want to make it clear that to use the Colorado QuitLine, it's available to any youth, like I said, 12 and older, and it does not require parental consent for those who are under the age of 18. So please get the young people you know served that their parents don't have to know, and they don't have to give consent that they are utilizing the QuitLine services. Next slide shows some contact information for the QuitLine. And then the QuitLine shared some of these best practices that are found on the next slide that I wanted to share with you guys with regards to referring people to the QuitLine. And I think this first one is important. So if you're able to, in the time that you have when you're with your young people, it's helpful to do an active referral to the QuitLine. On a previous slide, there was a link to how to do those referrals. If you are able to make the referral to the QuitLine directly for the young person, then you will receive information back from the QuitLine that lets you know if that person called or received any services. So that can help inform your follow-up to when they come back, if you know that they actually did use that referral that you gave to the QuitLine. All right. Next slide. We're running a little, I want to leave a little time for questions to make sure I addressed the issues you guys brought up at the beginning. So I won't go more into detail there on best practices. But I wanted to remind you all of the tobacco cessation counseling CPT codes that are out there. So you can get reimbursed for the work that you're doing. And if you provide greater than 3 minutes of tobacco use or tobacco cessation counseling or conversation, please use the CPT code 99406 and get reimbursed. And if you provide more than 10 minutes of counseling or intervention, you can use the CPT code 99407. All right, next slide, please. So on the Just Health Provider Review, as expert sites, and for those who are STEP sites, on the next slide, you will see that when you use the Just Health app, you need to go into the provider review afterwards and answer these questions. So it says, would you like to add tobacco, vaping, use, or exposure details for this patient? And that you must fill this out if you're participating in the STEP or expert projects. So please answer yes to this question, as it's the primary way that we collect these data around the work that you're doing and for these the effort and STEP grants. So on the next slide, it shows the good news is, as I understand, on a previous iteration of the provider review, you had to type in information. At least now it's just check boxes. So hopefully that helps a little bit with your time. But so the question was tobacco or vaping cessation counseling needed. Based on the student's answers, you indicate yes or no. And was education provided for secondhand smoke or vape exposure? You can indicate yes or no. On the next slide, you indicate what you provided. So whether it was counseling, an internal referral to a colleague, maybe in behavioral health or other provider, a health educator, or if it was an external referral. And then there's skip logic that based on your answers that will take you to the next appropriate question. Here's the place where you indicate was cessation counseling provided. And again, like I said, please don't forget to bill for that time if you provided at least 3 minutes. On the next slide, it's asking, did you provide any internal referrals to someone else within your clinic? And on the next slide, it will ask you about who those internal folks may be, which provider it may be. The next slide asks about the external referrals. And then on the next slide, you can indicate what external referrals you provided. All right. Next slide, I think, is questions. I wanted to go back. I know Rebecca asked at the beginning about what's the difference with quitting vaping versus quitting cigarette smoking. And I think what I would say about that is, they both contain nicotine. I think as far as the brain is concerned, the wiring is still the same. The effects of the nicotine on the brain is the same. The release of the dopamine is the same for tobacco versus vaping, or I'm sorry, for cigarettes versus vaping. However, from the provider perspective and what interventions or counseling to provide, I think the difference related to vaping and smoking is kind of around how and when and where and under what circumstances and under what emotions people are vaping. So since vaping doesn't have the awful smell, in fact, like cigarette smoke does, in fact, it can smell like candy, mangoes, mint, you name it. And like we were talking about earlier, it's easy for anybody to vape anywhere. That affects how people are using the products and how often they're vaping and how much it can get integrated into their just everyday activities to the point where it can become kind of, without even thinking about it, you just reach for your vape pen and there you are. So I think that that is the difference in terms of addressing strategies of how to identify how and when, what's driving the habit, what's motivating the desire to change, and how to respond instead for you know what to do to occupy your hands, what to do in those certain social situations, how to occupy your mouth, that sort of a thing. I think I saw a question just pop up. Was there one, Kevin?
There was, yes. It's asking if there's any evidence of teens using marijuana cartridges in their vape pens and passing it off as tobacco.
I don't know about any evidence specifically. My hunch, total hunch, is like, yes, that's probably happening. In terms of research, or evidence around that, I would have to look into those data. Last year, I think it was in 2019, it seems this COVID stuff has created such a time warp, it's hard to figure out when it was, when there was a lot of incidences of of lung issues and hospitalizations and some deaths related to vaping. Largely the evidence was showing that that was actually vaping THC. And so if that's what they're referring to. You're welcome. Are there any other questions out there?
So we've got a question that says, with your coaching experience, have you ever addressed how tobacco, and in particular vape product use, is kind of a social status thing for youth?
So I have to confess this will age me, but when I was a tobacco cessation coach, vaping wasn't a thing. It was pre-vaping use. And so for that specific experience, no. But with regard to the sort of status thing, I think it's important when talking to youth about that question is to understand what is it about vaping? How does it that's driving them to use? And if it's a status thing, what is it about it? How does it make them feel? How does it make them fit in with a certain group of people? And then considering alternatives for much like you would look at like what's a healthier way to manage your stress, looking at what's really going on there. I know that there's some really great work going on around the state, particularly with a coalition called Uprise, where what they do is they work with coalitions of youth to look at the root causes of young people's tobacco use and how they can address that change. And in one particular group in Colorado, what they addressed as the root cause of tobacco use was a lack of sense of belonging. And so perhaps that status symbol that some youth can identify with vaping is really related to a bigger feeling of a lack of sense of belonging and a longing that all people have, regardless of age, to fit in and to belong within their community and within their cohort of peers. And so having conversations with youth about what's driving that, and if it's a lack of sense of belonging, what else might be able to fulfill that need that all people have, and what conversations might you have with their peers about that, I think is a place to start. It's complicated though. Did we have another question come in, Kevin?
It did. It's asking if you could talk a little bit about explain any of the theories on why Colorado leads the nation in vaping.
Oh gosh. I'm trying to think if I have seen in the data any theories around why. I don't, and honestly, none are coming to mind. I'm curious about that. I want to note down and see if I can find anything, and if I do, I'll get back to you. I mean, initially, I would think that it's probably related, in part, possibly related to access and availability, but I would want to look into that more.
And we have a comment from Risa that says that she could speak to it if it's helpful. So Risa, if you'd like, you feel free to unmute yourself and
please
give a little information.
Thanks. So I'm with the Roaring Fork School Health Centers, but I was previously working for Pitkin County Public Health in the STEP program. I was the tobacco rep for Pitkin, Eagle, and Garfield counties, and we have some of the highest rates down here. So there's two main theories that I am aware of. One theory is about legalization of marijuana and the vaping pens being available in Colorado a little bit earlier, and just that social acceptance of vaping because of legalization of marijuana. But the other piece that's really striking, I think, is exactly what Christy said about access and availability. So the states that have the highest rates of youth vaping also are the ones with no tobacco licensing laws and lower tax rates. So our tax rate in Colorado is one of the bottom 10 in the country. In our licensing laws, we don't have a required tobacco retail license, or we didn't until recently, where some of the counties do. But we are among 10 states that also do not have licensing laws. And so those pieces actually increase the availability. Like our Healthy Kids Colorado here from 2017 showed that 65% of kids who use tobacco who are under 18 were buying it locally from brick and mortar stores in the Valley. And so it's that level of enforcement and licensing and policies. And so we were also a little bit late to the game to move to Tobacco 21, and that's a real social norm game changer. So those are the kind of biggest ones I've heard, Christy.
Yes, thank you for articulating. When I was thinking about accessibility, I was thinking, and I'm sure marijuana has something to do with it. And with regard, you bring up a good point, thank you, regarding retailer licensing. Before the pandemic shut down the legislature, there was a bill that had been introduced that, for one, aligned the tobacco law with the federal law for age 21. But secondly, it was going to increase the penalties and enforce kind of a structure around enforcement for retailers, and particularly retailers who sell tobacco products to minors. We expect that bill may be modified in the legislature now that they have reconvened. They only have a short time to finish up all of their work. But it had a fiscal note, meaning it needed some money to go behind the monitoring of the enforcement for retailers. And since it has a fiscal note, that portion of the bill is probably not going to pass. That's my hunch, at least, and what our lobbyist was thinking. And so that's probably something to take up in future years and continue to work on at a policy level and at a statewide policy level, I think, as opposed to community by community, because some communities have more strict rules than others, but to make it uniform across the state. Because as was mentioned, there are particular pockets of the state with looser rules and higher prevalence rates, and so we want to make it uniform and address that from a policy perspective.
Thanks, Christy. And I'm respectful of everyone. I know that we do have some people hopping off already, but there is one last question. If you can explain why LGBTQIA+ individuals have higher rates of use than cisgendered people.
So I think it's related to that sense again of belonging, of identity, of grappling with a lot of those issues related to identifying as LGBTQ+ youth that drive tobacco use. So as a way to manage stress, as a way to manage the difficulties of being closeted, or the fears related to coming out, or acceptance in communities and that sort of a thing. So I think that's a key driver to the higher prevalence. And there is more. The Truth Initiative has a lot more information and fact sheets related to that population specifically, if you're looking for support for students who identify as such.
Great. Well, thank you so much. We really appreciate everyone being here, and especially you, Christy. If it's all right with you, we'll send out a copy of the slides here. If anyone has any further questions, they can contact you at the address there. Gianna has posted also a link to the SurveyMonkey post-training survey. If you wouldn't mind, please making sure to fill that out. Otherwise, once again, thank you everyone for being here today, and have a great rest of your week.
Thank you.
Thank you.